Your joints don't just wear out randomly. There's a specific protein holding your cartilage, tendons, bones, and skin together, and your body starts losing it at 25. Not 60, not 50, 25. By the time most people notice something is wrong, they've already lost a meaningful amount of it. And here's what almost nobody tells you. The symptoms don't just show up in your joints. They show up in your hair, your nails, your skin, your digestion, and how fast your body heals after a cut. All of it connects back to one molecule. That's what this video is about. If clear, honest health information is what you're looking for, subscribe and hit like. That's how more people find this channel. The goal is 200,000 subscribers, and every single person who subscribes moves that number forward. Practical checklists and short health posts are waiting for you on Telegram. The QR code is up on screen right now. Let's run a quick check before we get into the science. Go through this list and track how many of these sound familiar. Joint pain, either during movement or just sitting still. More hair falling out than feels normal. Nails that split or peel easily. A general sense that your muscles are weaker and your body tires faster than it used to. Digestive issues, bloating, discomfort, an unpredictable stomach. And wounds or small cuts that seem to take forever to close. Count them up. If 3 or more of those apply to you, that's worth paying attention to. Because as different as those symptoms seem, they can all point to the same underlying problem. A shortage of one specific protein called collagen. Most people have heard the word collagen in the context of face creams or lip fillers. That framing does it a massive disservice. Collagen isn't a cosmetic ingredient. It's the most abundant structural protein in the human body. It makes up roughly 30% of your total protein mass, more than any other protein. Think about what that means. Nearly a third of all the protein in your body exists to hold your structure together. Your bones, cartilage, tendons, ligaments, blood vessel walls, intervertebral discs, skin, all of it depends on collagen for its shape and function. Collagen gives tissue two things at once: strength and flexibility. Strength without flexibility means the tissue snaps. Flexibility without strength means it falls apart. Collagen is what keeps that balance. Here's a concrete way to picture it. Think of your body like a building. The cells are the bricks. Collagen is the mortar between them. New mortar holds everything tight. Old, degraded mortar, the walls start to separate, gaps form, the structure weakens. That's the process happening in your joints, bones, and skin when collagen drops. Now let's get into why it drops, because understanding the mechanism is what actually helps you do something about it. Collagen is produced by specialized cells called fibroblasts. Their job is to synthesize collagen proteins and weave them into fibers that form the scaffolding of your connective tissue. Starting around age 25, which sounds early because it is, your fibroblasts begin producing collagen at a slower rate. This isn't a disease, it's normal biology. But how fast the decline happens is not fixed, and that's the important part. After 40, the rate of decline picks up noticeably. After 50, it accelerates again, especially in women. The reason is hormonal. Estrogen directly regulates collagen synthesis. When estrogen drops during menopause, collagen production takes a significant hit. This is why women in their late 40s and early 50s often notice all at once that their skin has lost its firmness, their joints have started aching, and their hair has thinned. It doesn't feel like a coincidence because it isn't one. It's a hormonal shift with a direct biochemical consequence. Testosterone plays a similar, though somewhat less dramatic role in men. Men past 50 aren't exempt from this. The trajectory is just slightly more gradual. Beyond age and hormones, several other factors accelerate collagen loss, and some of them are things people do every day without realizing the cost. Ultraviolet radiation from the sun damages the fibroblasts in your skin and directly degrades existing collagen fibers. Smoking is one of the most destructive things you can do to your collagen. It reduces blood flow to tissues and floods the body with free radicals, which are unstable molecules that damage cells at the structural level. Chronic stress raises cortisol, a hormone produced by the adrenal glands, and when cortisol stays elevated for weeks or months, it actively suppresses collagen synthesis. Sugar and refined carbohydrates trigger a process called glycation. That's when sugar molecules attached to proteins, including collagen fibers, making them stiff and brittle instead of strong and flexible. And chronic inflammation, which tends to go hand in hand with excess weight, poor diet, and sedentary habits, activates enzymes that literally break collagen down inside tissues. There's a pattern that shows up consistently in primary care records that illustrates exactly how this plays out. A patient, let's call her Linda, a 48-year-old teacher, comes in reporting knee stiffness in the morning and a dull ache when climbing stairs. She's been managing it with over-the-counter pain relievers for a couple of years. By the time imaging gets done, the joint space has narrowed and the cartilage shows clear signs of wear. Linda had symptoms early enough that earlier intervention might have changed the trajectory. But because the discomfort was manageable, she waited. The condition that's now on her chart is one that required years to develop and could have been slowed. That condition is osteoarthritis, and it starts with exactly the process we've been describing. The cartilage in your joints is a cushion between bones. Unlike most tissue in your body, cartilage has no blood supply of its own. It can't feed itself through the bloodstream. Instead, it gets nutrients from synovial fluid, the liquid that fills your joint space and acts as both lubricant and delivery system. The structural core of cartilage is made of collagen, specifically what scientists call type 2 collagen. This creates a mesh-like framework that traps water and molecules called proteoglycans, and together they form something that functions like a shock absorber. Every time you walk, your cartilage compresses and springs back. When the collagen framework starts breaking down, the cartilage loses that resilience. It thins, it cracks. Bones begin to contact each other directly. Pain, inflammation, and swelling follow. That's osteoarthritis. When it affects the hip joint specifically, it's called coxarthrosis. When it affects the discs and vertebrae of the spine, it's called osteochondrosis. Different names, same underlying story. Collagen breakdown in connective tissue. So what can you actually do about it? Let's start with food, because that's where most people begin. And the honest answer is a little more complicated than most people expect. Collagen exists only in animal tissue. Plants do not contain it. The best dietary sources are the parts of animals that most modern diets skip entirely: cartilage, skin, tendons, bones, and connective tissue. Bone broth, made by simmering bones for many hours, is a genuine source of collagen that leaches out during cooking. The same goes for aspic, which is essentially a traditional slow-cooked dish made from bones and connective tissue. When it sets into a gel at room temperature, that gel is collagen. It has a scientifically defensible reputation as a joint supportive food, not just a folk remedy. Seafood, particularly fish with skin like salmon, contains collagen, and marine collagen is considered one of the most bioavailable forms for human absorption. Chicken skin contains collagen, though it also comes with saturated fat that makes it less than ideal as a daily staple. Plant foods like soy products don't contain collagen at all, but they do contain phytoestrogens and other compounds that may support the body's own collagen production indirectly. Algae and seaweed work similarly, not direct collagen sources, but they contain nutrients that support the synthesis process. And then there's vitamin C, which deserves its own moment here, because most people don't realize how critical it is. Vitamin C is not optional for collagen synthesis. Without it, the fibroblasts that make collagen can't complete the job. The molecule literally cannot be assembled correctly without vitamin C acting as a cofactor in the process. This is not theoretical. The disease historically caused by severe vitamin C deficiency, scurvy, was essentially a collapse of collagen synthesis across the entire body. Teeth fell out, joints deteriorated, blood vessels bled, all of it traced back to one missing molecule. Today, severe deficiency is rare, but suboptimal vitamin C levels are common, and they quietly undermine the quality of collagen your body is producing. Bell peppers, rose hips, black currants, broccoli, and citrus are among the highest dietary sources. Here's the honest challenge with relying purely on food. To get a meaningful daily supply of collagen from diet alone, you'd need to consistently eat significant amounts of cartilage, skin, and connective tissue, or make and consume bone broth regularly. Some people do this, most don't. Not because of laziness, but because modern food habits don't naturally include these cuts. That gap is a large part of why collagen supplements have become so widely used, and why it matters to understand how to choose one correctly. There are more than 28 known types of collagen in the body. For practical purposes, 3 matter most. Type 1 collagen makes up the structure of skin, bones, blood vessels, and the cornea of the eye. It's responsible for skin firmness, bone density, and the integrity of your hair and nails. Type 3 is closely related to type 1 and is often found alongside it, contributing to skin and vascular structure. Type 2 collagen is the one that matters specifically for joints. It's the primary structural component of cartilage. If joint health is your concern, type 2 is what you're looking for. Many products on the market contain type 1 and type 3 because they're cheaper to produce. They're not useless. They support skin and bone health, but they're not the most targeted option for someone dealing with joint pain or cartilage issues. Beyond type, the form matters enormously. Look for hydrolyzed collagen, sometimes called collagen peptides. The collagen molecule in its natural state is too large to be absorbed through the intestinal wall. Hydrolysis breaks it into smaller fragments, peptides, that can actually pass into the bloodstream and reach the tissues where they're needed. Non-hydrolyzed collagen is largely wasted during digestion. Powder form is generally preferable to tablets or capsules for a straightforward reason. A serving of powder can contain a meaningful therapeutic dose, and it begins contacting the intestinal lining quickly once dissolved. Capsules require the shell to dissolve first, then the contents to be released, which adds time and dilutes absorption efficiency. And this brings us to dosage, which is probably the most ignored factor in the supplement conversation. Many products on the market contain 500 milligrams or 1 gram of collagen per serving. For a real physiological effect, research suggests the threshold is at minimum 3.5 grams per day, with 5 grams or more being a more reliable target. Always read the actual numbers on the label, not just the ingredient list. A product that technically contains collagen, chondroitin, and hyaluronic acid means very little if the doses are symbolic. Which brings us to the other compounds worth understanding, because collagen works better in combination with specific supporting molecules. Chondroitin is a natural component of cartilage tissue. It helps protect cartilage from breakdown, reduces calcium loss from bone, and importantly, helps cartilage hold on to water. Water is what makes cartilage springy. Without it, the cushioning effect disappears. Glucosamine is another cartilage component that blocks the enzymes responsible for breaking cartilage down. It also supports the permeability of the joint capsule, the membrane that keeps synovial fluid contained in the joint space. Without proper permeability, nutrients can't reach the cartilage. Chondroitin, glucosamine, and the next compound, MSM, are grouped together under the term chondroprotective agents. That just means they protect cartilage and support its repair. MSM stands for methylsulfonyl methane. It's an organic sulfur compound. Sulfur is necessary for building many proteins in the body, collagen included. MSM also has anti-inflammatory properties, helps reduce joint pain, improves local circulation, and may help break down abnormal calcium deposits in tissue. A documented pattern in clinical practice involves patients with chronic joint discomfort who, after adding MSM in combination with collagen to their routine, report noticeable reductions in daily pain without increasing pain medication. It's worth noting, not overstating, but worth noting. Hyaluronic acid is the main component of synovial fluid, the joint lubricant. It creates the viscous environment that reduces friction between joint surfaces and carries nutrients to the cartilage. In osteoarthritis, the concentration of hyaluronic acid in synovial fluid drops. The joint essentially starts running dry. Supporting hyaluronic acid levels through supplementation may help compensate for this, at least partially. And vitamin C, as discussed, must be present and in a real dose, not a trace amount. Its role as a cofactor for collagen synthesis means that without it, any collagen you take in simply won't be used as efficiently as it could be. One thing worth clearing up, because it's a common misconception: collagen supplements don't work by sending collagen directly to your joints like a delivery package. Any protein you eat, collagen included, gets broken down into amino acids during digestion. Your body then uses those amino acids as raw material to build its own proteins wherever they're needed most. The reason a collagen-specific supplement is still useful, rather than just eating any protein, is that collagen has a distinctive amino acid profile that's relatively rare in the modern diet. Providing those specific building blocks, alongside the cofactors needed to use them, gives the body what it needs to prioritize collagen synthesis in tissues like cartilage and tendons. Timing is worth a brief mention. Taking collagen either in the morning on an empty stomach or in the evening before sleep both have logic behind them. In the morning on an empty stomach, there's less competition from other nutrients being digested, and absorption tends to be more efficient. In the evening, the body shifts into repair mode during sleep. Tissue regeneration is active, protein synthesis ramps up, and growth hormone is released. Getting the raw materials in before that window starts makes intuitive sense. What matters more than timing, though, is consistency. The effects are cumulative. You're not going to feel a difference in a week. Research and clinical observation consistently point to 3 to 6 months of regular daily use as the time frame where meaningful effects become apparent. Taking something for 2 months and stopping is significantly less effective than maintaining the habit. One more thing that often gets left out of this conversation: movement. It sounds counterintuitive if your joints hurt, but staying still is not the answer. Cartilage has no blood supply, remember? It feeds through the compression and decompression that happens when you move. When the joint cycles through pressure and release, it draws nutrients into the cartilage from the synovial fluid. When you stop moving, that pumping action stops, and cartilage is essentially cut off from its food supply. This is why physicians recommend low-impact activity for osteoarthritis: walking, swimming, cycling, rather than bed rest. High-impact activities like running on hard pavement or heavy lifting with poor form do accelerate wear. The principle is the same as with almost everything in physiology. Too little is harmful, too much is harmful. Appropriate amounts are therapeutic. Here's a number that tends to land differently when you say it out loud. After age 40, the rate at which the body loses collagen is roughly twice as fast as it was before 30. After 50, that gap widens further. So here's a genuine question worth answering in the comments. How old are you? Not as a formality, your age shapes which part of this information is most immediately relevant to you. And knowing where the majority of this audience is in that range helps make future content more useful for the people actually watching. Here's what this all adds up to. Collagen is the structural foundation of every piece of connective tissue in your body. Production starts declining at 25 and accelerates meaningfully after 40. The things that speed up that loss: smoking, chronic stress, excess sugar, UV exposure, low estrogen or testosterone, chronic inflammation, are worth managing as directly as the collagen question itself. When collagen in the joints falls short, cartilage loses its structure, the joint loses its cushion, and you end up on a path toward osteoarthritis or related conditions. You can address that gap partly through diet: bone broth, cartilage, fish skin, connective tissue. But getting a consistently effective amount from food alone is difficult in a real-world diet. Hydrolyzed type 2 collagen, at a minimum of 3.5 grams per day, combined with vitamin C, hyaluronic acid, chondroitin, glucosamine, and MSM in meaningful doses, is an approach that's worth bringing up with your doctor, especially if you're already noticing joint symptoms. That last part matters. Bring it up with your doctor, not instead of your doctor. Use what you learned here to have a more informed conversation with a professional who knows your full medical picture. Everything in this video is for information purposes only. Your health is specific to you, and a real conversation with a qualified clinician will always be more useful than anything you watch on a screen. If this gave you something worth knowing, subscribe and leave a like. It helps more people find this channel, and 200,000 subscribers is the goal we're working toward. Health posts and downloadable checklists are on Telegram. Scan the QR code on screen and grab them.